Hey, this is Doc Riza again, talking about the neurologic disorders, specifically in the diagnosis and approach to the patient with the disease. And now this is specifically for medical students. We're gonna talk about the neurologic history. Okay. Attention to the description of the symptoms. So pay attention to the description of the symptoms experienced by the patient and substantiated by family members. Family members, of course, add something to what the patients talk about their symptoms. Okay, and others often permits an accurate localization and determination of the probable cause, even before the neuro exam is performed. So by history, you can have an idea of an accurate localization of the lesion for this disease. The history also helps focus the neuro exam that follows, obviously. Each complaint should be pursued as far as possible to identify the location of the lesion, the likely underlying pathophysiology, and potential etiologies. Okay, for each complaint, you have to identify the location of the lesion because it is from where you have to treat it. And of course, the underlying pathophysiology, what happened to that, and the potential etiologies, what could have been the causes. Okay. For example, a patient complains of weakness of right arm. This is just an example. Weakness right arm. What are the associated features? Does the patient have difficulty with brushing hair or reaching upward? Proximal or buttoning buttons or opening a twist-up bottle, which is functioning with distal muscles. Yeah. Okay. Negative associations may also be crucial. A patient with a right hemiparesis without a language deficit likely has lesion that's internal capsule, brainstem, or spinal cord different from that of a patient with a right hemiparesis and aphasia. So there are two patients, both with right hemiparesis, and the other one is without a language deficit. The other one has an aphasia. So the problem here with the aphasia is from the left hemisphere. Okay. And the right hemiparesis comes from the right internal capsule, brainstem, and spinal cord. Other prominent features of the history include the following. So there are about 7. Okay. Number 1, temporal course of the illness. And number 2, patient's description of the complaint. Number 3, corroboration of the history by others. 4, family history. 5, medical illnesses. 6, drug use and abuse and toxin exposure. And 7, formulating an impression of the patient. So what are these 7? These are pertinent features of the history. Okay, again, temporal course, of the illness, of course. The description of the complaint. The corroboration of history, by, of course, may it be family or other people. Then, you have to get something from family history and the medical illnesses, and then the drugs being used and being abused, and if there are certain toxin exposure, and on top of it, or at the end, you can formulate an impression of the patient. So this is how you go about the history. Okay, let's discuss it in detail. Temporal course of the illness. It is important to determine the precise time and appearance and rate of progression of the symptoms experienced by the patient. The rapid onset of a neurologic complaint occurring within seconds or minutes usually indicates a vascular event, a seizure, or migraine. Okay, so take note, if there is rapid onset within seconds or minutes. That means it is a vascular event, seizure, or migraine. Okay, rapid onset, again, vascular event, seizure, or migraine. To adjacent portions of that extremity and then to the other regions of the body suggests a seizure. Again, what is it? Seizure. There is onset of sensory symptoms in one extremity. Don't forget one extremity first. So there is onset of that sensory symptoms. It spreads over a few seconds to adjacent portions of that extremity, of that same extremity, and then to the other regions of the body. Okay, so the sensory symptom starts in located in one extremity, in one extremity, and then you suddenly see it spread to adjacent portions for after a few seconds, and then to the other regions of the body. So that is a seizure. Okay, it starts, then it spreads, and then later on to it's present in other regions of the body. Okay, so it is a seizure. A similar but slower temporal march of symptoms accompanied by headache. Okay. Accompanied by headache, nausea, or visual disturbances suggests migraine. Okay, if there's something like that, sensory also, sensory symptoms also, but accompanied by headache, there is nausea, and visual disturbances, that is migraine. Okay. Less well-localized symptoms that are either sudden or more gradual in onset point to the possibility of a transient ischemic attack. Some are TIAs, okay? Less well-localized and sudden or more gradual. Okay, those are TIAs. The presence of positive sensory symptoms. What is that? Positive, it says positive. Example, tingling or sensations that are difficult to describe or involuntary motor movement suggests a seizure. In contrast, transient loss of function or negative symptoms suggests a TIA. Okay, listen. For positive sensory symptoms, for example, tingling or sensations, but you cannot describe it fully or you cannot describe it precisely, or there is involuntary movement, well, this is a seizure. But when there is TIA, there is transient loss of function. The function is really not elicited. You cannot move or you cannot feel, so this is a TIA. Transient. Okay. But when there are symptoms and then it's difficult to describe, it's a seizure. Okay. A stuttering onset where symptoms appear, stabilize, stuttering, it says. Stabilize, symptoms appear, stabilize, and then progress over hours and days also suggests cerebrovascular disease. An additional history of transient remission or regression indicates that the process is more likely due to ischemia rather than hemorrhage. Okay, so when it is ischemia, this is what happens. There's a stuttering onset where symptoms appear, stabilize, and then progress over hours or days. So this is a cerebrovascular disease, it's obvious, and there is an additional history of transient remission or regression. It is saying something that this process is more likely due to an ischemia in the brain or in the central nervous system. Okay, a gradual evolution of symptoms over hours or days suggests atoxic. Remember, gradual, okay. gradual evolution when over hours or days suggests a toxic, metabolic, infectious, or inflammatory process. So if it's gradual, it means hours or days. It could suggest a process which is toxic, of metabolic, or infectious or inflammatory origin. Okay, don't forget that one. Even metabolic could be slow in process, gradual. Okay, progressing symptoms associated with the systemic function of fever, stiffening, and altered level of consciousness imply an infectious process. Okay, if the symptoms are progressing and then associated with systemic manifestations like fever, stiffening, and altered level of consciousness, this implies an infectious process. So this is fairly common, yeah. As this is really common as an infectious process. We may say like this is meningitis. Okay. Relapsing and remitting symptoms involving different levels of the nervous system suggest MS or other inflammatory processes. So when the symptoms are relapsing or remitting, it's coming over and stopping and then coming again. This involves the different levels of the nervous system. This could be MS or other inflammatory processes. Slowly progressive symptoms without remissions this time. Okay, slowly but without remissions. Or correct. Okay, chronic infections, gradual intoxications, and neoplasms. Okay. Slowly progressive without remissions. Neurodegenerative disorders. Okay. If this is slow but without remissions, then this could be neurodegenerative disorders. This could be neurodegenerative. Look at the term. Neurodegenerative, because this is slowly. Okay, degenerative, that's the clue word. Then chronic, yeah, because it's slowly. Then gradual intoxications and neoplasms. This is all about slow processes, right? Okay. Number 2, patient's descriptions of the complaint. Let's see. The same words often mean different things to different patients, of course. Dizziness may imply impending syncope when they say dizziness. Okay, you may feel that